Welcome back to the exam room, where we explore the people, ideas, and innovations shaping healthcare in our communities. Today, we're joined by Dr. Eric Black, a dentist and healthcare leader whose career has been dedicated to expanding access to care and serving underserved populations. From providing hospital based dentistry in Native American communities through the United States Public Health Service, to leading dental programs in Arizona community health centers, Dr. Black has spent nearly 2 decades helping patients overcome barriers to care. In this episode, we'll explore what oral health can teach us about access, prevention, patient centered care, and the unique challenges facing rural communities. We'll also discuss the importance of meeting patients where they are, both physically and emotionally, and how innovative approaches like mobile dentistry are helping bridge gaps in care. Dr. Black, welcome to the exam room.
Hi, good morning. Thanks for having me.
Absolutely. Thank you so much. I'm excited to dig in. I think maybe we should just start by talking a little bit about your journey. Have you always felt called to help others, and what led you specifically towards dentistry?
Well, I have felt like I've always been called to help other people. Early in my life, I had some amazing experiences where I was there to help people in like significant need. One was a car accident, and the other was a drowning victim. And I think that was kind of the spark
Mm,
to my journey. I didn't quite know where it would take me, but everything after I did that, was involved in those two events, had to do with other people, not myself. Yeah, I just always wanted to focus on someone else. It was more interesting and more rewarding. So everything I do kind of involves other people.
That feeling resonates with me too, and I would be willing to bet that most of us in healthcare have been called to help others, and while we're here, I know that's what fills my bucket is knowing I'm helping somebody else. So, what led you to dentistry? Can you share a little bit about that?
My passion is working on cars, and I love using my hands. And I grew up with my grandfather, who was a mechanic, master mechanic out of the Navy, and then he was a cabinet maker, carpenter. So he did fine detail work. And, when I was young, I would spend a lot of my time with him, and I would just be his laborer. But I'm watching the whole time and I'm learning. As I grew up, I think I have a lot of those traits. But what he was really doing was more amazing than what he was building with his hands, which was impressive. But he was
Mm,
connecting with people. He was one of the coolest people I've ever met. Super kind. He would, I hate to say it, but he would give away his work most of the time.
mm,
So he would build cabinets for people that didn't really have the money, that were struggling. He built cabinets, meaning kitchen cabinets, room additions, bathrooms. So anything that includes like finishing work. And after the job, I would ask him, "Oh, Granddad, did you make a lot of money?" He said, "Not really. I broke even." And I said, "Wow, you did all that work basically for free." He's like, "I know, but I love what I do." I kind of took that concept and that influence into what I do now as a professional. I think I owe it all to him, and what he was doing really impressed upon me to focus on other people, not myself, but to use my hands, and I think my personality to connect with other people and just do something meaningful.
We talk a lot about patient engagement. It's definitely a buzzword, and connecting with other people as humans first before we maybe connect with them as like the patient doctor relationship and the importance of that. What would you say has kept you passionate about this work over the years?
Oh, every day is a new day. Like I pop up out of bed, I'm not joking, at 4:30 a.m., sometimes sooner, and give my coffee. I prepare for the day, flip on the computer, get ready, and then I go through the front door at work like it was my first day on the job. I think my teammates are a little behind on my energy level. Like they're not there yet. I don't think they ever will be. But I think it's so fun because every day is something new. You meet new people, it's a new challenge. Nothing's the same. It never will be until the day I retire. Like it will always seem like this endless variety of work. Yeah, it just keeps me going. It's so fun. And then you get to meet all these people. You know,
Mm.
my teammates are amazing. Like the company I work for is incredible. People are so kind, so passionate about what they do and supportive. So, I mean, how could you not want to go to work in that type of environment? And then I got to play with all these cool dental instruments, right? Like all day long. It's so fun. And then to meet all these different people. And what's cool is when you leave the day, you know, after 8 hours plus of work, you look back and you could quantify like all the good you did for someone else. There's a lot of positions you can't do that, you know. So I think that really keeps me going.
I can see the passion, I can hear the passion. Not everybody wakes up that way.
No,
Well, what do you do in that instant? Like, is there ever a day when you don't wake up that way?
no.
Tell us a little bit about where your career started and what that experience taught you.
Okay, so I graduated from the University of Iowa, and senior year there was an officer came in a uniform, and he looked so good, and I thought I want to do that. Well, I don't know what he's doing, but I want to be part of that. I really didn't ask too many questions. He told me that he was recruiting for the United States Public Health Service, and I said I'm in. Like, tell me where to sign. Like, tell me what to do. It was that fast.
Wow.
A lot of my family members are in the service or have served. And I thought, like, how can I be of service as well? You know, and what's nice about the United States Public Health Service, it's the uniformed services, but it's non-combative role.
Mm.
So you don't bear arms and you don't go to war for them. So that's fantastic. So you can be part of the system and you're safe. Yeah. I mean, so much respect for those people that put their lives on the line for us. Thank God for them, and they're some of the bravest people in the world.
Mm.
Um, but I thought, you know, how can I um, still give back without having to put that forward, that type of risk? And so,
Yes.
yeah, I was recruited right out of dental school, and I went to the Navajo Reservation. As my duty station was in Tuba City, and I served 4 years there.
Can you share a little bit about what that first experience taught you or how it helped you to shape your understanding of healthcare access?
Before I went to Tuba City, I really didn't know much of anything about Native American tribes. I went to undergrad school at University of Utah, and I did take some Native American history, but reading about it in books has, in my opinion, nothing to do with living amongst them or being part of their culture.
Yeah.
So it was a huge learning experience about this population that's out there that a lot of people don't know about. They really hold on to their traditional ways. And sometimes what that does is it doesn't allow outsiders in. So being
Mm.
part of the United States Public Health Service, that particular duty station has accepted officers for years. So it was this entrance into a whole different world. And what comes with that, in order to be successful, you have to respect.
Mm.
It is their world, it is their land, it's their culture, and we are just a guest, and it's their home. So what I learned from early on is that there's this amazing culture that's out there that we must respect, we must notice, and everyone on the planet needs help,
Mm.
and we help them, and they help us. And not a lot of people understand that. You know, it's a mutual respect that you should have for certain cultures, even though that you don't know anything about them.
Mhm.
And so I took that kind of learning lesson everywhere I go. So, you know, I've moved around the United States a few times, and I I try to think about giving respect. with everybody I meet, with the different geographic locations, the folks that I work with. So I think it just kind of permeates into everything I do. And I was taught that by the Navajo, along with many other lessons. It was a wonderful experience, and I recommend it for anybody.
I hear you talking a lot about respect. What does that look like to you? Or could you give us an example, maybe, where you had that exchange with someone and you know that you were, establishing that respect?
Yeah, I do it in the office every day. So I'll tell you this one story, if you don't mind. I'll make it as short as I can. Young mom walked into the office one day. She's 20, early 20s, I think 22, 23. She has a few kids. When she smiles, the teeth are black in
Mhm.
general. They're broken down, huge cavities. She's shy, she's embarrassed. She hides her face. She won't look at me. So I ask her, what can I do for her? Why, and she doesn't really want to say too much because she doesn't want to share because I don't think people have sat and talked to her. So I told her, I
Mm.
said, look, we're not going to do any dentistry today. We're just going to sit and talk for a while. And that day we didn't. We spent like 30 minutes just talking. She told me about her life. She had three kids, no money, stayed at home. Her goals were to just get outside the house again so she can work, but she couldn't work with the decay problem. No one's going to hire her. And she said also that she had been to three or four other dentists in our city and nobody would treat her because they labeled her as a meth user. And so she's
Mm.
crying the whole time. And I said, look, I don't judge. No one here is going to judge you. And what we're going to do is exactly what you're interested in and no more. So I said, if we can come to some agreement where you allow me to help you, I'll do whatever you would like. And her main goal was just to work outside the house. So I said, well, what did the other dentists in town want to do? They said, extract all my teeth
Mm.
and give me dentures. She said, oh, I'm 23. I don't want that. And I said, I don't want it for you either. I said, that's crazy. So people were just, not giving her the benefit of the doubt that she could go the distance with her dental work, but also nobody decided that they really truly wanted to help her as a person. They were just looking at teeth.
Mm.
Yeah, so I told her, look, when you come here, we're going to treat you like family. And I'm going to do what I'm going to do for you, what I would do for like my mom or my sister. And we're going to go slow and it's going to go at your pace and your comfort level. And so what I want her to know is just, I respect you as a person first. And it's not about me. Everything I do is not about, it has nothing to do with me. Thank God, because I don't like being the center of attention. It's all about you. So I'm so glad that she allowed me to treat her. And here's the thing with that. She had zero money. So you have to respect folks like where they're at. So not everybody can afford what we do. Does that mean they're not worthy? No way.
Mhm.
If you're alive and walking the planet, you're worthy of health care, whether you can pay for it or not. So I got her some help. I got her, at the time I was working for a FQHC that had an angel fund, and the angel fund paid for a lot of her dentistry. And then I think we wrote some off, and then we put her on the slide toward the end. Yeah. So, anyways, I got
Mm.
before and after photographs. We were able to fix her up. We would give her hugs every time she walked in the office. She was crying a lot. The staff was crying
Mm.
a lot, and she looked amazing. And then one day she came in. She says, "I probably won't see you for a while because I got a job."
Oh.
And she never returned. But that's the biggest compliment, ever. But I think all that comes with just showing respect and not labeling people or judging
Mm.
people. I'll never forget her. To the day I die, I'm not gonna forget her. And
You
I've helped
changed
a lot
each
of
other.
people like that too. I mean, it's amazing. There's just so much opportunity to do that type of work.
You changed each other's lives.
Yes. And
Yeah.
you can do hard things. The reason dentists wanted to extract her teeth because it was hard to save them.
Yeah.
They wanted the sure thing. They wanted the easy way out. It's hard. It took time. and patience. But it also takes, good eye-hand coordination. You got to be good with, yeah, you got to be good with your materials. You got to
Yep.
understand the process. I mean, there's a lot that goes into it.
The conversation doesn't end here. In the coming episodes, we'll hear how innovative programs are bringing dental care to rural communities, why prevention matters more than most people realize, and how compassion, trust, and connection can overcome some of healthcare's greatest barriers. Because as you'll hear from Dr. Eric Black, every interaction matters, and every person deserves to be seen, heard, and cared for. We'll see you next time on The Exam Room.